In 1944, a man with no medical degree, no college degree, no high school diploma beyond basic education, walked into an operating room at Johns Hopkins University and changed medicine forever. But America wasn't ready to give him credit for it. Born the grandson of a slave in Louisiana in 1910, Vivian Theodore Thomas started his working life exactly where the system expected him to stay, as a janitor. By 1930, he became a lab assistant. By the 1930s, he was performing the work of postdoctoral researchers. By the 1940s, he pioneered cardiac surgery. He was never paid like any of them. According to Johns Hopkins hospital records, Vivian Thomas developed surgical techniques that solved what doctors called the impossible. The tetralogy of Fallot, known as blue baby syndrome, was a death sentence. Newborns with this condition turned blue because their hearts couldn't pump oxygenated blood. Doctors watched babies die. Then Vivian Thomas stepped in. Working alongside surgeon Alfred Blalock and cardiologist Blalock-Taussig, Thomas didn't just assist. He designed the procedure. He tested it. He perfected it on laboratory animals before they dared touch a human patient. On November 29, 1944, when Blalock performed the first surgery on a 15-month-old girl named Eileen Saxon, Vivian Thomas stood behind him, directing every move. When her skin turned from blue to pink, cardiac surgery was born. Within a year, more than 200 babies had that surgery. The procedure, now called the Blalock-Taussig shunt, has saved thousands of lives across the world. But the history books? They credited Blalock and Taussig. Thomas got paid like a janitor. Here's what they don't teach you. For 35 years, Vivian Thomas supervised Johns Hopkins' surgical laboratories. He trained generations of surgeons who became chiefs of departments across America. His hands were so skilled that when Blalock examined one of Thomas's suture lines, he said, "Vivian, this looks like something the Lord made." The Sheridan Libraries at Johns Hopkins document that Thomas worked through Jim Crow segregation. When he walked those halls in his white coat, people stopped to stare. Black employees at Johns Hopkins were only janitors until Thomas arrived. He couldn't eat in the cafeteria with white doctors. He earned extra money bartending at faculty parties to support his family. Not until 1976, 66 years after his birth, 32 years after he invented modern cardiac surgery, did Johns Hopkins finally give him an honorary doctorate. Not a medical degree, an honorary one. That same year, they named him an instructor of surgery, an instructor, after he'd trained their best surgeons. His portrait now hangs at Johns Hopkins alongside presidents and department chairs, but his name isn't on the procedure he invented. The Blalock-Taussig shunt should be the Blalock-Thomas-Taussig shunt. Medicine knows it. Johns Hopkins knows it. History knows it. But America still hasn't fully reckoned with it. This Black History Month, we celebrate Vivian Theodore Thomas, the man who pioneered modern cardiac surgery despite a system that tried to erase him. The man whose hands saved thousands of babies. The man who proved that genius doesn't ask for permission, doesn't wait for recognition, and doesn't stop when the world says you don't belong. In 2020, Johns Hopkins launched the Vivian Thomas Scholars Initiative with a $150 million investment to ensure that students from underrepresented backgrounds can pursue PhDs in STEM fields. They're finally building the pathway Thomas had to create himself. So here's my question for you. How many Vivian Thomases are alive right now, creating groundbreaking innovation in garages, laboratories, and communities, whose names will never be written in textbooks? How many discoveries are we losing because we refuse to look beyond what someone looks like or where they started? That's worth thinking about. That's worth sharing. And that's worth making sure your kids know this name. Like this. Share this. Follow for the untold stories of Black excellence that changed the world.